So good afternoon, everybody. My name is Claire Wardle, and I'm the co-director of the Information Futures Lab based at the Brown School of Public Health. And today we're going to be talking about community information needs in Rhode Island, with a particular focus on mental health, reproductive health, and climate change. The Information Futures Lab was launched around this time last year. Our website reads, "Our lab is where technology, innovation, policy, and community meet, one pilot at a time." And that is certainly what we've been doing the last few months. I'm here today with a number of members of my team, as well as some of our wonderful students, to talk about a project that we've been working on this semester that illustrates some of the work we're doing at the lab. But I wanted to start with the context that drives our work. People think we're living in the middle of a misinformation crisis, but we're actually not. We're living in the middle of an information crisis. There's a number of reasons for this, and you know many of them. We have overlapping health, economic, climate, and political crises that are being complicated by changes in information technology, ecosystems, and consumption. We have rapid news cycles. We have evolving science. And unfortunately, we have outdated communications practices, news deserts, and the exploitation of networked information environments. And these modern day information challenges are leading to increased information needs inequities. So as you can imagine, our lab is quite busy. Before we get started, I want to get a sense of how today's topic might relate to you. So going back to that opening from a couple of minutes ago, thank you for giving me all of those examples of searches that you have been doing. And I would love to think about whether or not when you did some of those searches related to health and well-being, whether or not you felt that you were getting quality information, were the results answering the questions that you had, particularly if they were locally focused searches. So again, maybe in the chat, if you feel comfortable, I'd love you to just give a sense of whether for some of those questions, you did find that you could easily locate accessible, useful information. So I'll just give you a couple of minutes, because I think that's the question. It's less what are you asking, it's when you get there and you see 3 million or 38 million results. From this example we have about tick species in Massachusetts. That was me. I had a tick on my dog. So in that context, we're really interested to know whether or not you feel like it's easy to access that information, particularly in the local context. But actually giving another personal example, I moved to Providence in December and heard in the dog park, where you get all the best gossip, that this building had actually had a pretty serious lead pipe issue in terms of the water. And so I ended up coming back to my apartment and searching, how do I know if my Rhode Island property has a lead water problem? The results are actually pretty good. Turns out Providence Water offers a map, and you can click on your building and find out when your lead pipes were replaced. But it's not always the case that helpful information is readily available to us, and that's what we wanted to investigate. So at the beginning of this year, for the spring semester, we decided to pilot what we've been calling the Information Project. The design of the project involves 3 phases. We've just finished phase 1, which is what we're going to talk to you about today. The idea was to understand the information landscape in Rhode Island around these 3 topics: mental health, reproductive health, and climate. We did this by observing public searches and conversations online to understand what communities were talking about, what questions they had about different topics, and what they were confused about. We then compared those questions and concerns with the kind of information that was being pushed out by news organizations, local government agencies, or community-based organizations. So we were trying to look at a kind of supply and demand. The next phase is to really spend time working deeply with the communities themselves and those organizations and institutions that they trust for information. As a result, we hope to get a much deeper understanding of some of the top-line findings that we're going to share with you today. The final phase is to partner with some of these organizations to co-create solutions that might help to fill the information gaps we identified in this project. Quick note, and an important one, going forward, the phases will be switched. So we'll start by talking with communities. But to be totally honest, we didn't know what we were going to find, and we wanted to get a better sense of what the information landscape looked like before reaching out to organizations that we know were completely stretched to the limits. And these are the students who worked alongside the team at the lab this semester. About 30 students participated in 2 evening training sessions in February. About 15 of them signed up to continue with the project. These students really are incredible. Because it was a pilot, we had no payments or academic credits to offer, but they worked on the project just for the love of it. And we'll get to hear from a few of them about some of the things they took away from the project during this session. But I just want to stress that it was absolutely magic to work with them over the last few months. We also found this to be an incredibly rich topic for working with students because there aren't any textbooks on doing this, not yet. I just loved it because each week we ourselves were thinking about what was interesting and then co-designing new methodologies and ethical practices with the students. And we certainly ended up having very long conversations about the ethics of doing this work. Should the students monitor conversations in a Rhode Island local Facebook group if they had to apply to join? The consensus was that we should focus only on public groups with no application process. But every week there were different considerations we discussed. And each week the students did different tasks. Sometimes it was a platform profile where they did deep dives to investigate the characteristics of different platforms. And I remember Owen, one of our students, coming back and saying, "Oh, I spent a lot of time on Reddit this week and I saw people encouraging others to get coordinated and to go and post misinformation in other subreddits." So that was really powerful to see the students themselves uncovering different tactics and trends. And one of the key benefits that I hadn't considered when designing this project was that in order to understand the whole information ecosystem, the students had to spend time in online spaces that they wouldn't normally inhabit and saw views that were very different to their own. So we often had conversations about what it felt like and what were the mental health repercussions of sitting in communities where people were saying lots of things that the students didn't necessarily agree with. And I think from a pedagogical perspective, doing this work and then having space to discuss the discomfort of hearing views that challenge our own was very important. Finally, I'd also just want to say that there are amazing things happening across the state and across campus that do some of the things that we're highlighting here. There are real innovations being rolled out by local community groups and local government agencies. For example, this one podcast from Rhode Island's Department of Health called Public Health Out Loud is one of these examples. Another is the Possibly podcast that you might have heard broadcast on the public's radio, which is an attempt to try and to answer people's questions that they have around climate. This is done in partnership with the Institute of Brown for Environment and Society and the Climate Solutions Lab. Or the Hassenfeld Institute, right here at the School of Public Health, that's working on adolescent mental health initiatives in Rhode Island. We are really excited about finding ways to connect with other groups and initiatives across Rhode Island to partner on some of this work. By co-creating information products together, our hope is that people in Rhode Island can have easier access to information that they can use to make decisions that will keep themselves, their families, and their communities safe and healthy. So let's dive into the methodology. How did we do this? And for that, I'm going to hand over to my colleague, Shadene Urbani, who was the overall manager for the information project.
Thank you so much, Claire. So there were a number of phases to the collection of data in this project. For those of you who do work with or about social media platforms, you may know that it's very difficult to isolate conversations and information online in a particular location. The internet just doesn't have borders the way that maps do. So the first step in doing this kind of qualitative content analysis is to build lists of online sources of information that are connected to Rhode Island. Politicians, community-based organizations, journalists, people at universities, etc. Once we built that database of sources, we can use it to track conversations. This is also an ongoing process, so we update our lists continuously to make them better, and it's also replicable, so we can make new lists to track different types of conversations if we have new research questions. The second piece of this is building a database of keywords related to our investigation, and then using those keywords to build complex search queries that we can repeat across different platforms. Now, this is a place where we actually have to be really, really thoughtful about how different communities use language. For example, the word climate. Journalists and activists use the word climate in their communications all the time, but a lot of other people don't. People in Rhode Island are definitely talking about climate-related issues, for example, heat waves or their energy bills. But if we only search for conversations using the word climate and not that other language, we might not have found much. We then went and collected data from different online platforms, including Facebook, Instagram, Twitter, Reddit, and to some extent, TikTok and YouTube. Here's an example of some discussions of wind farms on the Providence subreddit. And as you'll hear later in this presentation, there are actually some pretty active subreddits for Providence on Rhode Island. Here's another example. These are some results for what you will find if you search mental health Rhode Island. And as you can see, the search results are relevant, but the view counts are very low. And this is something interesting that we found on YouTube for all the topics we investigated. The engagement on these topics on YouTube is just not very high in Rhode Island. So we also used several different social monitoring tools to do this. Here's an example from CrowdTangle. CrowdTangle is a tool that we use to monitor Facebook. It allows you to build lists of public Facebook pages and groups, and it also has a pretty strong search function with a limited but very useful local relevance filter, which is what you see here. If you look closely at the top, you'll see that this is a search query we were using to look at posts about abortion, in particular, the State Equality and Abortion Coverage Act. We also did some more high volume data collection to investigate what search results look like on Google and what people might be searching. So we scraped or automatically collected the questions that Google suggests in its people also ask sections, as well as the URLs that it's pointing users to answer those questions. Now, on the note of high volume data, we've also been working with Indrajit Haldar, a creative developer and researcher with a strong background in computational design and data science, to think about new and creative ways to collect and analyze local sources. And Indrajit is here, so if you want to say hi to him in the chat, please do so. And finally, for phase 4, we then use a database called Junkipedia, which is a tool that is specifically designed to do this kind of work, to collect examples of things that we were seeing. We taught the students how to identify either examples of misinformation, people asking questions or demonstrating confusion about an issue, and even examples of effective communication that were possibly serving community information needs. Now, of course, with a project like this, there are plenty of limitations, and I want to highlight a few of those here. Number one, this work was done predominantly in English. We did do some work in Spanish, but it was limited. And we would love to replicate these methodologies in other languages, but in particular, Spanish and Portuguese because of our location. Number two, we were only looking at public conversations, as Claire mentioned previously. We are very aware that some, if not many of these conversations are happening in family or community WhatsApp groups or closed Facebook groups. Number three, as I stated before, local monitoring is challenging. And in some cases, there's just no way to guarantee that something we were looking at was posted by someone in the state. But we did do what we could to isolate conversations in Rhode Island. And finally, these findings are based primarily on a 1-month snapshot, although we did continue some of our monitoring to understand how communities responded to changing issues. So for example, the Equality and Abortion Coverage Act going up for vote was happening just as we were wrapping up our initial report, of course. And this is the same for the legal fight over the abortion pill that's happening at the national level. Now, what is clear is that you can't just go in and do this type of analysis as a snapshot and then disappear. So what we're trying to do is set up systems that will allow ongoing analysis of these trends, particularly around questions that people are asking as information changes, and especially when national conversations are changing as well. So today, we are very excited to be publishing 3 short reports. They're designed primarily for people who might have the ability to help respond to community information needs. So that includes local newsrooms, local government agencies, and community-based organizations. Now, these reports have ideas for serving those needs from our team, but I want to emphasize that they are quite top level because we just haven't spent the time working deeply with those of you, and I know that many of you here in the audience fit the description, who are working on the front lines of these issues. But our hope is that this can be a starting point for conversations with all of you about how we can do this work and how we can do it well. Now, before I hand over to my colleagues to tease out some of the findings in this report, does anyone have any questions about the methodology we employed or any other overarching questions about the project? think also we're a small enough group that you can just unmute yourself if you have a question. You can also put it in chat if you need a moment to think. Okay, well, I think we're going to move on then. But as I said, put your question in the chat and we'll try to answer it if we see it there. Okay, first up is my colleague, Kaylin Dodson, along with her students, Amrik, Amelia, and Lucy, who will talk about their report into the community information needs related to adolescent mental health in Rhode Island. After their presentation, we're going to open it up for questions. And we will do that after each topic's presentation. We will also have a bunch of time at the end for a discussion about ways to move this project forward for those of you who are interested in pitching us ideas. Right.
All right. Thank you so much, Shay. Hi, everyone. I hope you're all doing well. We titled our work, "The Kids Are Not All Right," an information study on adolescent mental health in Rhode Island. So before we get started, I would like to make a quick content warning. This part of the presentation features topics that may be triggering, including suicidal ideation, self-harm, and disordered eating. According to the CDC, the number of children and young people experiencing mental health challenges has been increasing since 2010. And the COVID-19 pandemic unfortunately created a new set of challenges. Further, in Rhode Island, close to 38% of high school students reported feeling sad or hopeless in 2021, up from 26% in 2015. Today, more and more young people are turning to social media for information about mental health and to find support. The increase in mental health issues among young people, along with the widespread use of social media, has prompted concerns about a potential link. Research has shown that social media can have both positive and negative effects on adolescent mental health, but its precise significance remains unclear. What is clear is the need for improved mental health information and services for young people. Addressing the adolescent mental health crisis in Rhode Island requires knowledge and insight into the questions and conversations young people are sharing online. To meet the needs of the variety of people affected by mental health challenges, whether that be parents struggling to get help for their child, those who are new to Rhode Island and looking for providers, or even young people themselves who don't know where to turn when they're in a mental health crisis, it's essential to examine what people are sharing online and why information is failing to reach them. The aim of our report is to help bridge information gaps and identify information challenges that prevent young Rhode Islanders from getting support.
All right, so for this report, we defined adolescent as a member of Gen Z, ages 10 to 26. Because this report is focused on mental health of Gen Z, we investigated phrases and colloquialisms used by young people online. These phrases are used to evade or navigate platforms' content moderation. This method isn't new or unique to Gen Z. It's something we have seen, for example, with folks using the number 2 and the letter A to evade moderation around the term Second Amendment. A Gen Z example of moderation evasion is using sewer slide to navigate around content moderation for the term suicide. Another example is depressy, used for depression. Then we have beans or hitting beans, which is a term used to talk about self-harm. And finally, we have phrases like Anna, Annie, pro Anna, and Ed without Sharon, all of which are used to reference eating disorders. We want to note that these keywords that we highlighted are not exhaustive, and they're used in a range of online conversations. The keywords themselves should not be used to draw conclusions about the content of those conversations. Our research demonstrated that people use these online spaces in various ways for many reasons. Calls to remove these conversations are not only fruitless when it comes to content prevention, but they often miss the different roles these communities can play for people struggling with mental illness. Focusing on just the platforms ignores the much more important need to ensure that young people seeking out information are provided with the support that they need.
Outreach that too often failed to connect with large audiences. Content and conversation online reveal that residents and care providers feel disappointed and dissatisfied with available mental health services. This may reflect that the current care and support aren't meeting people's needs. This isn't to say Rhode Island's government isn't trying to address the rise in mental health challenges among young people. It may, however, mean that because of residents' continued frustration and skepticism, Rhode Island officials' messages are not reaching their target audiences. This can be backed up by the relatively low engagement on social media posts from Rhode Island officials regarding efforts to address the mental health crisis.
Questions that need answers. These are some of the questions that we found through our analysis of Rhode Island Google searches and social media that demonstrate what mental health supports young people are looking for. They include questions such as, is there a bipolar support group in Rhode Island? And other things like, how do you get diagnosed with ADHD in Rhode Island? We also identified questions that may not explicitly mention mental health, but they're linked to the effects mental illness can have. For example, the significance of the question, at what age can a child drop out of school in Rhode Island, comes from research showing that nationwide, among students who do not complete high school, over 20% prematurely end their education because of early onset psychiatric disorders.
So here are some key takeaways and ideas for meeting community information needs we made based on this preliminary investigation.
First, Rhode Island officials could work to improve engagement with their online outreach efforts. In this report, we discussed low engagement on these social media posts. We can infer that using the more mainstream social media outlets, such as Facebook and Twitter, doesn't seem to work for gaining Rhode Islanders' attention. We did find that Reddit has a robust community of Rhode Islanders. The subreddit r/Rhode Island is one of the more active spaces we observed. The phrase mental health appeared 29 times in Rhode Island subreddit comments since the start of this year, making it a popular topic of conversation. Further examination could reveal what the popularity of Reddit in Rhode Island means for the demographic of people engaging in these conversations and how they choose or choose not to be perceived online, as Reddit is particularly anonymous. Speaking anonymously about personal topics such as mental health can offer a sense of safety and privacy that not many other platforms can. With this in mind, based on our research, Rhode Island officials and professionals might consider engaging with Rhode Island subreddit more, or move their announcements and efforts away from online and towards in-person conversations, with proposals that hold institutions accountable for putting mental health initiatives into motion.
Secondly, Rhode Island residents are calling for more mental health support and improvement of existing resources. As we previously demonstrated, there is a disconnect between official Rhode Island sources and on-the-ground experiences. While there are a lot of mental health services available, residents express difficulty in seeking out and receiving quality care. Rhode Islanders also expressed concern that not enough is being done to address issues related to mental illness, such as economic insecurity and unaffordable housing. It may be that information about what services are available to Rhode Islanders isn't reaching them. This may be evidenced by the lack of engagement on government pages and posts. This may reflect that officials and organizations need to find new ways to communicate with residents and make it easier for them to feel heard.
But only blaming platforms is not the route to take. In our research, we noticed a lot of people outside of Gen Z talking about Gen Z and youth mental illness, garnering substantial engagement. It is less so for young people who are speaking up about their own lived experiences. For example, TikTok is a current hub for young people to express themselves. We should take advantage of that and listen to the voices these spaces amplify. Furthermore, efforts should address the other known drivers of mental illness in adolescents, rather than hyper-focusing on negative content on social media. We cannot conclude whether people are using certain search terms to evade moderation as a means to find or post harmful content, because those same terms can be used to find peer support. Harmful themes in social media aren't new, they're recycled. As a result, this problem requires solutions that combine offline and online approaches. We need a user-based, user-centered approach to understand why this content is so pervasive online, and more research with communities to understand how and where additional support would be more beneficial. So to close out our presentation, we wanted to highlight some of the learnings from our students, who I am so proud of, and who worked so hard on this project. First up is Amelia.
Thank you, Kaylin. So overall from this experience, I learned that the way people perceive mental health issues varies based on whether or not they are affected by those issues. So to me, it's really important to look at, especially those affected, to understand where there are areas of frustration and where information can be improved for them specifically.
And next up is Amrit.
Thank you, Kaylin. From the info study experience, I learned that the Rhode Island crisis is exacerbated by the lack of mental health services accessible for residential health and care providers, which ultimately induces feelings of disappointment and dissatisfaction in regard to available care and support.
And last but certainly not least, Lucy.
Thank you, Kaylin. From this project, I was able to learn more about the different information spaces of all the groups in Rhode Island, and that oftentimes the spaces where Rhode Islanders express their thoughts and concerns often don't reach people in power or those who provide the necessary resources, and vice versa.
All right, thank you all so much. So we're gonna open up the floor for questions. All right. If there aren't any questions, I'm going to hand it over to my colleagues, Daisy Winner and Kung Chen, who worked on the project examining information needs related to abortion in Rhode Island.
Yeah, hi everyone. Thanks, Kaylin. First, I just want to start by apologizing for potentially some noise. My neighbors are kind of like low-key avian enthusiasts / I live around a lot of construction in a city with a housing crisis. So there's a bit of noise going on. But yeah, we just wanted to start by sharing some background about the work we did related to examining the abortion information ecosystem online for folks in Rhode Island. So as many of you probably know, in June 2022, the US Supreme Court struck down Roe v. Wade, which left power to individual states to decide access to abortion for women or people who are pregnant. And since then, 19 states have either banned or restricted abortion based on gestational limits. So when someone is banned from accessing abortion care, they're compelled to continue a pregnancy that is against their will. And in many cases, there might even be a serious health threat. And decades of research has shown the many impacts of abortion barriers on individuals and communities, including increased rates for complications during pregnancy and delivery, higher rates of maternal mortality, poor physical and mental health outcomes in the future, higher rates of financial insecurity, and lower rates of educational attainment. So the consequences from the restrictions to abortion access disproportionately harm women of color and low-income women. And here is a chart that shows pregnancy-related mortality by race and ethnicity through 2016 and 2018. These are the groups that already have less access to contraception, they're more at risk for pregnancy and delivery complications, and they have the least access to prenatal and obstetric care. In contrast, though, abortion is actually one of the safest procedures performed in the US, and it's much safer than childbirth. The risk for mortality from childbirth in the US is estimated to be about 14 times higher than the risk from abortion. So today abortion is legal in Rhode Island, but legality doesn't guarantee access and substantial barriers remain, such as the ban related to insurance coverage for state employees and those who are enrolled in Medicaid. And so currently there are about 80,000 people enrolled in Medicaid and another 6,500 on state insurance who are of the reproductive age of 15 to 49 years. So it's a not an insubstantial population of the state. And Black, Latino, Hispanic, Indigenous, and other low-income women in the state are definitely more likely to confront these and other obstacles to care. What's critical, though, is that individuals with unwanted or unintended pregnancies need comprehensive and accurate information about what pregnancy options are available to them, like what options cost and what they require, and also like how to access those resources. And so not only is this information critical to obtaining like timely and safe care, like making an appointment, but it's also, research has shown, a pivotal part of when someone goes to make a decision about whether to terminate or keep their pregnancy is the feasibility of actually obtaining that care. So the quality or information plays a role throughout the process. And so our report focused on examining what Rhode Islanders are sharing about abortion online, the questions they're asking, and the accessibility of relevant and reliable abortion information. So next, we're going to share some of our findings.
Yeah, thanks so much, Daisy. So our work really revealed how legal and logistical barriers create their own set of information needs, illustrating how complexity begets complexity, or how the specifics of an individual situation, say insurance status, can make finding relevant information increasingly difficult. A notable example is abortion care costs. Those paying out of pocket, such as people on Medicaid or state insurance, could have any number of critical questions, such as, how much does it cost to get an abortion in Rhode Island? What is the difference in cost between a medication and surgical abortion? What are my options if I can't pay? Is there a way to get financial assistance? And so on and so forth. We found some challenges to getting answers for these questions. For example, looking up the costs of abortion. The abortion providers in Rhode Island offer limited information about pricing on their websites. Additionally, a Google search on this returns links to other national organizations, providing only cost estimates for procedures in the state. In most cases, there are additional steps people must take in order to obtain detailed information about exact amounts, payment options, and how to access financial aid. To get more information, a person would need to make at least one phone call to either the care provider or their insurance company if they are enrolled. Other barriers could include transportation, childcare, or even lost wages from taking time off of work. In considering how barriers could add up, we should also think about how getting this information could potentially be more difficult. For example, placing a phone call might be difficult to those who may not have access to safe and private places, for people working multiple jobs and may not have the time to call, and for those who may not even have access to a phone.
Yeah. So just here is just two screenshots from about the available hours that both clinics, in-person clinics in Rhode Island are open, which is basically when anyone works a job. Another significant finding from our work was the significance in the state of crisis pregnancy centers, also known as CPCs, or pregnancy care centers and pregnancy resource centers. These organizations offer counseling and prenatal services from an anti-abortion or pro-life perspective. Some of them actually promote themselves as women's health clinics, but they operate without any oversight or regulation from health agencies. And CPCs work to dissuade people from obtaining an abortion with tactics including misleading or false information. And a recent analysis of 456 websites from organizations across 12 states found that 80% of the information on these sites contain misleading or inaccurate information regarding the risks associated with abortion. So we also searched for a number of key terms related to pregnancy and analyzed the results to see what kind of information Google was giving to users. What we found is that searches for resources and support such as pregnancy assistance or pregnancy resources, or like really critically, free pregnancy test, were more likely to yield results for anti-abortion organizations and crisis pregnancy centers. And like the free pregnancy test is really important when we think about the cost differential or even the convenience of medication versus surgical abortion, which we know is like bound by gestational limits. We also noticed that when typing pregnancy into Google Maps, Google automatically suggested pregnancy care center. And upon selecting this option, all the results in the menu were CPCs rather than medical clinics. But interestingly, when you looked at the map, the results were mixed. And it makes sense that if someone is searching for pregnancy resources, that they wouldn't be pointed just to abortion resources or abortion providers specifically. And like, we agree with that. And that's not what we're suggesting. We're actually suggesting that what people need is to be pointed to information that can give them an accurate and complete insight into all of the options that are available to them. And CPCs are documented as exaggerating the risks of abortion and encouraging women to delay their decision, which in turn narrows their window for obtaining an abortion, and like a risk across all of these factors goes up.
Yeah, we also looked at social media to see how Rhode Islanders were discussing abortion at the local level. There was some content from journalists and politicians, either broadcasting new articles or legislative positions, but across the board, there was a lack of conversation and dialogue about abortion. This on the screen right now was one of the very few examples we found, and it was on the Providence subreddit from 5 years ago. There were also Facebook ads from across the spectrum, some of which can be seen on the screen right now. The lack of public conversations online about abortion makes sense, right? As public platforms may not feel like safe spaces for people to have these intimate conversations. And these findings follow trends from previous research, namely that internet searches related to abortion are directly proportional to local restrictions on abortion, which are low in Rhode Island.
So we also found that the quality of information might be limited for particular communities. For example, those who speak other languages. We did a search of how to get an abortion in Rhode Island in Spanish, and none of the top results were for either of the local in-person providers, but rather national organizations providing information. It's also significant that crisis pregnancy centers in the state have connections to religious institutions, and 42% of the state's residents identify as Catholic. And this could mean that folks with a religious background might fear the stigma of seeking out information from an abortion clinic or abortion provider, or just fear being in a looking for information in a social environment that doesn't support their information seeking. So these are ideas for meeting community information needs after doing this work. First, we need to make more locally oriented abortion information more available. So like making it easier to find results related to abortion providers in Rhode Island. Secondly, create explainers that address information gaps and are easy to understand. Third, provide more ways to access abortion information besides making a phone call. So this could even look like an online chat available to folks. And finally, make resources that are relevant to particularly vulnerable communities. So making it easier to find information in other languages. Yeah, so we want to open it up for questions, if anyone has any. It's cool.
All right, thank you all so much. If you do have any questions, feel free to drop them in the chat. And now we're going to hand it off to our colleague, Rory Smith, to talk about climate change in Rhode Island.
Thanks so much, Kong. The effects of climate change on Rhode Island are well documented, and in some cases growing more consequential. Rising temperatures, heat waves, hurricanes, and severe winter storms all threaten the health and well-being of Rhode Island residents. Researchers found that from 2005 to 2012, warmer daily temperatures were associated with an increased number of admissions to emergency departments across the state's hospitals, particularly for heat-related conditions such as kidney disease, as displayed in the charts on the left. And more recently, researchers from Brown's Warren Albert Medical School revealed that higher daily temperatures resulted in an increased number of calls to emergency medical services during the summers of 2018 and 19, as you can see on the right. Historically oppressed and economically marginalized residents face the greatest consequences. In Providence, for example, neighborhoods with the greatest number of Black, Hispanic or Latino, and Indigenous residents and the highest rates of poverty have fewer trees compared to wealthier and whiter neighborhoods. And urban tree cover has been shown to reduce heat-related illness and death. Now, most Rhode Islanders agree on the existence of human-caused climate change. However, our work revealed two core dissenting groups online and across social media: climate skeptics and opponents of policies that address climate change. Now, while their numbers are small, we found evidence online of influential figures such as Representative Patricia Morgan spreading misleading information about climate change and renewable energy sources. And on Twitter, we came across an active group of weather enthusiasts and amateur meteorologists from Rhode Island and New England who challenged the idea that unusual weather events are linked to climate change. And through news and social media analysis, we also discovered a patchwork of online news outlets, accounts, groups, and users pushing out content, undermining efforts to build renewable energy sources like offshore wind and solar in Rhode Island and across New England. Now, we found evidence of climate conversations pertinent to Rhode Island occurring in various spaces online. However, many of these conversations weren't couched in language and terms that you might expect. Given increases in home energy costs, much of the climate-related conversations online revolve around financial challenges and speculation about how different forms of energy, including renewables, might drive energy prices up or down. And without keywords capturing these narratives, these conversations might be lost. As an example of this, the screenshot on the right shows numerous posts on the Rhode Island subreddit related to home utility costs. And by auditing Google's search results and related questions features, we also discovered a considerable lack of information for residents in Rhode Island, specifically linking the effects of climate change with its health impacts. We generated this word cloud from 29,000 Reddit comments posted between January 1st and March 17th, 2023 from the Rhode Island subreddit. Now, the chart underlines the prominence of home energy issues such as heat pumps and natural gas, as you can see there. And it's one example of many other methods that can be used to take the temperature of conversations online about different climate-related topics. Based on our work and our findings, we offer several ideas for meeting community information needs. First, engaging the many communities in Rhode Island about climate change and health requires an interdisciplinary approach. The participation from a broad range of stakeholders, including government agencies, researchers, community-based organizations, and local news and media outlets, will be fundamental to meeting the informational needs of Rhode Island residents. We also need to consider the less obvious ways that residents are confronting challenges at the intersection of climate change and health. For anyone attempting to track, monitor, and make sense of online conversations about this issue, it's important to have relevant keywords that reflect the many issues adjacent to climate change. For example, wind, energy costs, fishing, and heat pumps, and which are constantly updated as new issues enter the fold. And in order to engage Rhode Islanders about climate change and the threat it poses, particularly to their health, consider where it fits into their day-to-day life of residents. Research shows that people facing financial insecurity tend to focus on the present, not the future, and on current situations rather than hypothetical ones. Thus, messaging about the future sea level rise might fail to engage people versus current challenges, such as increasing utility bills. And lastly, we need to address informational gaps and misleading narratives. publishing pre-bunks, which are effectively warnings informing people about specific rumors they might encounter, or explanatory pieces addressing residents' concerns in an easily accessible format and in different languages would fill these information gaps. And that's all we have. Thank you very much. And does anyone have any questions or comments about the climate-related findings?
I have a question.
For sure.
So this kind of applies to all of y'all's presentations. I noticed each of y'all said at some point that, one possible solution would be to address informational gaps. And, I wonder if y'all had any ideas, like concrete ideas on how to do this.
I have one idea. I'll kick it off. There are many ways of doing this. One, it's working with like local affiliated news media to again publish explainers, etc. Another interesting thing we found though by querying and kind of auditing Google search results is there is a lot of space for improved SEO strategies, right? To better get this content up there. The content is out there in some cases. In some cases, it doesn't exist. It needs to be built or written or published. And then there is ample space to get that stuff lifted up. So maybe just teaching basic SEO practices would be one feasible and kind of pragmatic way of going about this. But that's just one idea from my end.
Yeah, and I'll just jump in there just to build on what Rory's saying, which is in many ways, it's not that the information isn't there, but if I had a magic wand, I would put designers in every government agency. A lot of what we're doing is we're throwing text back at the problem. And as many of my younger team members will tell me, if you're spending time on TikTok, so much of this is around a visual culture. And so when we talk about meeting community information needs, it's about the explainers, exactly to Rory's point. What exactly are people looking for, and how can we illustrate and explain some of the kind of fundamental aspects to these problems, as opposed to, or here's an article about it, but it's not necessarily explaining. So that for us, we're thinking about building out resources and training materials to help think about those kind of ideas. But it has to be co-created with organizations who know their audiences and know their communities far better than we do. Thank you for the question. Spot on.
Any other questions? All right. I want to pass it on now to Jordan Abelson, who worked with us closely on this project.
Thank you, Rory. Hi, my name is Jordan Abelson, and I am a very soon-to-be graduate of the Masters of Public Health program here. I've got one final left, and I'm hoping to submit it tonight. Throughout my course here, I have been fortunate to take classes that have emphasized the importance of various public health concerns and strategies to increase the population's health. However, throughout my curriculum here, I noticed that the threat of misinformation was not adequately addressed, yet it impacts almost every topic we find here in public health. The spread of misinformation can erode public trust in health organizations, hindering the dissemination of accurate and timely information, and ultimately reducing the effectiveness of public health officials. Fortunately, my training with the Informations Project has prepared me with the tools and the knowledge to combat misinformation and enter my career with a renewed sense of purpose. The program has complemented my coursework and enhanced my abilities as a communicator, a researcher, and overall just a member of society by empowering me to make more of a significant impact on society. Working along with the fabulous members of this lab has truly been a highlight of my time here at Brown, and I am truly honored to be part of the inaugural cohort of student researchers. The experience and internships have given me the opportunity to learn from experts, apply skills to real-world problems, and it has helped me land a job that I definitely would not have been able to get without the skills that I learned in this lab. I'm grateful for Brown University and the School of Public Health for supporting such an innovative program such as the Information Project. This lab truly equips the future public health professionals like myself with the skills to tackle the current information crisis. Thank you, and I will pass it back to the wonderful Claire Wardle.
Thank you, Jordan. And I just want to make clear that I did not pay Jordan, and she was the one who was like, I want to say something. So Jordan has been a wonderful member of the team, particularly helping us on the reproductive health work. So we're very sad to see you graduating, Jordan, but it's been wonderful working with you. So I just also want to thank everybody else who presented. Of course, many of our students are deep in finals, but thank you again so much for those of you who are able to join us. And so here are the reports. They are just literally hot onto the WordPress. They just got uploaded in the last half an hour. They are short reports, are about 5,000 words each, and they're just an attempt to start a conversation around these issues. So please go to this short link and you'll be able to find all 3 reports there. We do have a few more minutes left. I know normally webinars are an hour, and I'm sure lots of people need to go and light the barbecue or walk the dog, but we would love to hear from anybody about particularly potential additional topics that we could explore in the fall, maybe ideas for partnering organizations or institutions that we could start talking with, ideas for resources, guides or training courses that people might think would be helpful. And certainly anybody on the webinar from Brown University, from both a research and pedagogical perspective, we'd love to think about ways we can integrate the information project across campus. And maybe a student who wants to work with us next semester. But I don't know if anybody wants to add anything in chat or to share any examples, but we'd love to hear anything that maybe this presentation has kicked off.
I have a suggestion for places where y'all can find like public opinion about stuff in an in-person format.
That sounds amazing.
So sometimes at the Capitol building, there will be different hearings for various bills. I've been to a few myself about, abortion, climate bills, various things like that. And often, people will go to testify, just regular people, and you can hear a lot about what their concerns are and what they think just based on the things that they testify about. So, for example, I went to one last year. It was about the Equality for Abortion Coverage Act. And there were people who were both for and against it. And everybody brought up a lot of different points. So if y'all are curious to see what people think, like in an in-person setting, you might be worth checking it out and seeing, what bills are coming up and, going to check out those hearings.
That's amazing. We're struggling to see who's talking. So if you would able to put your name in the chat, we would love to reach out. But I love that. I used to teach research methods, and when I used to teach ethnography, I'd encourage students to go and sit in laundromats and just go and spend time in spaces to hear people having conversations. And so you're absolutely right. School board meetings, places, state house, laundromats. People are too young, but bars, places where people can, we can actually hear people having these conversations and not just rely on these online spaces, what we spent so much time in.
And Maya, just to add to that, actually, I attended every session of the Senate and the House of Reps here in Rhode Island, and I pulled from all of the testimonies that I heard and I recorded, and I started to pull that into our search queries to hopefully tag things that were online. So we didn't necessarily pull statements from that environment, but we use that as a listening tool for me to design my Boolean searches to better find maybe places and terms that we weren't naturally finding from just our initial research. So yeah, that's a great idea.
Thanks. Yeah, Jordan often late night in Slack was telling me what was happening from the State House. Any other comments or thoughts or ideas?
Hi, I see Reginald, you have your hand up.
Hi, greetings. Greetings. My name is Reggie Williams, and I lead the international program at the Commonwealth Fund, a healthcare philanthropy. I'm also a graduate of Brown and a mentor to a few people there at the School of Public Health. And I just want to say congratulations. This work is really important. I've spent a lot of my time working on research, issue briefs, long documents and things like that I know people don't read. And so I think one of the really kind of interesting and helpful things that you can think about doing is sharing with people like me and organizations like mine tools, resources, guidance on how we can start to take the work that is buried in the paper or in these online spaces and make it real for people. We've experimented with things like documentaries and podcasts and the like. We're scared of TikTok, not sure how that works yet. And so, when you have these 100-year-old and mature organizations, giving them guidance and support and ideas on the ways they can communicate better is always very welcome. So just cheers to all of you for your hard work, and it's really inspirational, and hope to see more.
Oh, Reginald, that's so great. Thank you so much. And I mean, you're exactly right. There's two parts to this, right? It's about how do we create innovative, engaging content? And then secondly, how do we make sure that people find it? So actually, one of the findings that, I mean, there's so much that we couldn't include, but when we were looking to see where Google was sending people from those snippets of people also asked, a lot of it was press releases. So really dense PDF, just text, even if there was better links that Google could send people to. So there's also this battle of, we can create great content, but if we're not being indexed, then people can't find it. So yeah, it's such a great point to help people around both those things.
I was also going to say, Reginald, if you wanted to, or Reggie, if you wanted to check out the Info Futures Lab site, we actually put together a report related to vaccine demand, which integrates, like, I think, a lot of unique sort of strategies around how to reach people. And I think one of the big findings, even from this work and our other work related to vaccines, is that we have to really as organizations, step outside of our comfort zone of how we communicate with people, right? So like a good example is trusted messengers or whatever, right? Like use trusted messengers, and you're like, okay, but we always rely on the same people. And we have to be able to be uncomfortable with trusting folks who we might not normally include as communicators, right? And realize that everyone has knowledge in all of these different ways is like a good example. And yeah, but our report about building infrastructures as trust is what it's called. And it's a link on the website. I would definitely check out.
And I'll also say, Reggie, don't be too scared of TikTok. It's not as intimidating as you think. Pinky promise, it's not.
As you may be able to tell, Kaylin has the most beautiful voice. And so we want to make Kaylin a podcast star, or maybe I wanted to do TikTok, but she refuses. But she could definitely teach other people how to do it. And I think as you may be able to pick up, one of the things that we're trying to figure out here is, what does this methodology look like for doing this in Rhode Island as a way that we could potentially then work with people in many other parts of the country and lots of other universities and community colleges and other community-based organizations to do this work, so we can really start to improve across the country by using kind of standardized methodologies and tools. So that's really what we're aiming for, but we're only going to do that once we've really done a lot of work here to figure out how to do it properly. And that's part of having this webinar, is to start these conversations. So I don't want to keep people any longer, but are there any last questions or thoughts? Well, oh, Julie.
Sorry to send that at the last second.
No, I love it. Yes, absolutely. I mean, so as you say here, you name the kind of Black barbershop health outreach program, the great work that's done by Stephen Thomas at the University of Maryland. But that's exactly the next phase, is to really say, well, where's the most effective places we could be? And really communities themselves are going to say a whole host of places that we probably even haven't thought about. And to Daisy's point about who are the best trusted messengers, there's going to be all sorts of things that we hear. So that's really, we wanted to have something that was a conversation starter, but really there is not going to be one size fits all. And as we saw with the mental health work, what many of our students were talking about around what Gen Z wants is very different from other communities who are going to want something else. So for us, it's about working closely with different communities to understand their needs. So yeah, it's a great question, Julie. And I wanted to see if I can find that report. Here we go, because the report that Daisy mentioned is full of wonderful insights. So I want to make sure that we get that out to people. So here's the link.
And to Julie's question too, like one of the things we learned from our vaccine work as well is like, we worked with over 90 different community-based organizations across the country. And the majority of them, even though we were doing vaccine work, didn't have anything to do with public health, right? And we really expanded who gets to be a part of like the public health workforce, and that it's recognizing that getting vaccinated or whatever is a part of all of these different pieces of someone's life. So when they're also maybe going to figure out how to get insurance or housing assistance, et cetera, we can also talk to them about these other aspects. So yeah, that's a great question.
And to also say another thing that we learned working on that report is that we really do have to work to build those person-to-person connections. No one appreciates a big institution coming into their community and being paternalistic or parachutey or saying that they know how to help you and they haven't even asked what your name is first. So I think something that we really want to incorporate and have be one of our goals at IFL is to create that person-to-person interaction where we're not just looking for a community and we can say, well, this is what we can do. We're actually want to talk to them and ask like, well, what can we do for you guys and what do you guys need help with? And how can we support that journey and that endeavor? And I think that's something that's really important for addressing information needs.
Thanks, Kaylin. Okay, everyone, it is a beautiful Thursday evening, and so we are going to say goodbye, but I'd like to thank everybody who attended, and I'm hoping that we might hear from some of you afterwards. We have a little Google form for those of you who would like to stay in touch, but thank you for spending an hour of your time with us. We really appreciate it. Please read the reports, share them around. This has been recorded, so if you have colleagues who would like to hear it too, we're happy to pass that on as well. But I'll just say happy Thursday and enjoy the sunshine.